femoral shaft fracture. Vinquist-Hansen classification, as discussed previously. Nail ream 2 mm above the length. Always examine the knee at the end of procedure. Lateral femoral nail in AP view, entry point should slightly lateral to the greater trochanter. In lateral view, entry point is in line with the axis of femur. Nail rotates 90 degrees during the insertion. Close fracture gap in order to decrease incidence of non-union. To minimize chance of cross-threading, turn end cap counterclockwise until thread to end cap align with that of nail. To remove broken nail, use extraction hooks. Ream medullary canal 1.5 mm more than nail to clean the path of the distal nail. Complication is rotational man-union. For that, you use lesser trochanter shape sign or cortical thickness and diameter sign. So, for rotation, you can check the lesser trochanter, number 1. Number 2, shape and sign of the cortical thickness. Number 3, you can see the diameter of the proximal and distal ends. For angular malalignment, you can use a cable, and put-in nerve problems is possible when because of traction pin. VT and NICE guidelines advise mechanical and chemical thrombolysis until morbidity not significantly reduce. NICE guidelines risk assessment is age more than 60, active cancer, acute infection, obesity, and smoking. Fat embolism 3 to 4%. Avoid IM nail for bilateral femur fractures. Important to know, Pepe et al. Cherney 1993 discussed the primary intramedullary nail for femoral shaft fracture could contribute to ARDS in the presence of chest injury. 33% ARDS in patient with chest injury versus 7.7% without chest injury. This is the only paper in Pepe et al. Which shows ARDS. In 2011, femur fracture can be nailed safely with chest injuries if patient oxygenation hydration status is optimal. Damage control of orthopaedic is still advisable in unstable and extremist situation. If you have a non-union, there is increased risk of non-union with smokers and heavy post-operative use of NSAIDs. Exchange nail using conversion of plate fixation plus bone grafting is possible.